Hello friends, this is your friend in health Dr. Sandeep Jassal and welcome back to our channel on YouTube, that is Live Life More, and today we are going to talk about stroke. Have you ever seen a person who's limping because of a paralysis, or do you know somebody who has lost his life just because of a stroke? Well, stroke, which is also called a brain attack, is the second biggest killer in this world, my dear friends. And it can either be an ischemic stroke, which is due to the blockage in the blood vessel which is supplying blood to the brain, and the other type of stroke can be a hemorrhagic stroke, which means that there's a bleed inside the brain which lands the brain up in a pool of blood, and that reduces the functionality of the brain. Well, about 87% of the strokes are ischemic strokes, which means they are caused by clots, they are caused by blockages in the blood vessels supplying the blood to the brain. So, in this video, I'm going to talk about 7 best things which you can do to minimize your stroke risk. Yes, and stroke prevention can even start today if you want to. Well, because age makes us more susceptible to having a stroke, as does having a mother, a father, or other close relatives who has had a stroke. So if you have some relative who has had a stroke, then your risk of having a stroke is higher than the one who doesn't have a relative, a direct blood relation who has had a stroke. But you can't reverse the years of your life, but you can of course reverse the risk of stroke. You can't change your relatives, you can't change your family history, but yes, by controlling certain risk factors, you can definitely reduce your risk of stroke. That is due to, my dear friends, knowledge is the power. If you know that there is a particular risk factor that is sabotaging your health and predisposing you to a higher risk of stroke, then you can take steps to alleviate the effects of those risk factors, and you can reduce the risk of having a stroke. Now the question arises, how to prevent stroke? Well, here are 7 ways, 7 best ways I would say, to start reining in your risks today to avoid a stroke before a stroke has the chance to strike you. Yes, yes, my dear friends. Today, if you take these steps, then of course your tomorrow can be stroke free. The first step is lower your blood pressure. Well, if you have high blood pressure, it is a huge factor, a big risk factor, doubling or even quadrupling your stroke risk if it is not controlled. Monitoring blood pressure, and if it is elevated, treating it is probably the biggest difference people can make to their vascular health. Yes, my dear friends, the health of their blood vessels, the piping system which supplies blood to your brain, to the whole body, is called vascular system, and the best thing you can do is to maintain a healthy blood pressure. Now, your ideal goal to maintain a blood pressure is of maintaining it to less than 130 by 85. 135 is the systolic blood pressure, 85 is the diastolic, the lower blood pressure, and if not possible, then at least aim to control it to the extent that you should have 140 by 90 and not more than that. Now, how to achieve it? You will say that why should I have medication? Well, medication is not everything you need to do for controlling your blood pressure. There are certain other things which you can do, and the first step is to reduce your salt intake in your diet and reduce it to less than 1500 milligram a day, which is about half a teaspoon, and avoid high cholesterol foods such as burgers, cheese, and ice cream. That is because these foods, fast foods, have high cheese content or high fat content, which is a big source of cholesterol in your diet. Eat at least 4 to 5 cups of fruits and vegetables every day. One serving of fish 2 to 3 times in a week, and several daily servings of whole grains and low fat dairy products can go a long way in preventing your risk of stroke and reducing your high blood pressure. Get more exercise, at least 30 minutes a day for at least 5 days in a week. That is what you should be aiming at. And by doing this, you can reduce your high blood pressure. And the other important thing to do is to quit smoking if you smoke, to quit tobacco, because tobacco is an independent risk factor of stroke as well as of high blood pressure. And if your doctor or your physician has recommended you medication, then don't deny that. Take medication, because medication is for your benefit. The doctor or the physician will himself taper off when these lifestyle habits give you a positive effect. The second tip is to lose extra weight. Yes, my dear friends, obesity, as we all know, it has got several complications, including high blood pressure and diabetes, which raise your odds of having a stroke. If you are overweight, losing as little as 10 pounds or even around 5 kgs. And I sometimes tell my patients that if you're overweight by more than 20% of your ideal body weight, then aim to reduce at least 10% of your extra weight. And you should aim at bringing your body mass index, which is also called BMI, to around 25, which is the realistic goal. And you can work with a certified doctor or a dietitian who can help you with an effective personal weight loss plan or a strategy. And we also do, as a team over here at Live Life More, we help people lose weight in a healthy manner. And but if you ask me, what is the thumb rule of losing weight, how to achieve your dream goal weight, how to achieve that, then I would say that you should try eating more vegetables, more fruits, and you should try to restrict your overall caloric intake, if you're a woman, to 1300 to 1600 calories in a day. And if you're a man, then you should restrict your calories to 1500 to 2000 calories in a day. And it depends upon, it is customized, the solution is customized according to your activity level, your current BMI, your goal body mass index. And increase the amount of exercise you do with activities like walking, golfing, playing tennis, and by making activity a part of your every single day, at least for 5 to 7 days in a week. 5 days is pretty much achievable. I also try to achieve that. Well, the third most important point or way to reduce your risk of stroke is to exercise more. Whatever level of physical fitness you are at, but there is always a scope of improvement. Exercise contributes in losing weight. It helps you lower your blood pressure, and it also stands as a independent stroke reducer factor, which you can use, because exercise gives your blood cells mobility so that the clot formation tendency is reduced. So your goal should be to exercise at a moderate intensity at least 5 days in a week, as I already have mentioned that in the earlier tip as well. So how to achieve it? It's easy to achieve. You should try to take skip the elevator and take the staircase if you are living in an apartment. If you are going to the office, which is at a higher floor and not at a ground floor, or park your car or vehicle far away from your in your parking. And you should start a fitness join a fitness club. If you think that you're not able to maintain that routine, then that you get motivated by other people surrounding you in the fitness club, so that you also do something when you see other people doing the required workouts. And your workout should be good enough to make you breathe hard, and but it should not be that harsh a workout that you're not able to complete a sentence. So that is it about the exercise. And if you can't gather 30 to 40 minutes of consecutive minutes of exercise in your day, which I have always seen in my patients who are elderly patients, they said they get tired. So I tell them that you take breaks in between, and you go for 10 to 15 minutes of walk, and then take a break, sit down for a while, and then again walk. But you should increment your exercise by 10 minutes more if you're taking breaks. And the next point is that you should reduce your alcohol intake. Why? Because drinking even beyond a limit, the alcohol is an independent risk factor for stroke. Though in a restricted quantity, the alcohol has been said to be, in studies it has been proven that it can help you reduce the risk of stroke and heart disease. That is because it alleviates certain amount of stress. But what I have seen is that people forget about their limits when they start drinking, and they very easily cross their limits and they go beyond 2 drinks, 3 drinks, or 4 drinks, which means their appetite also goes up. And you know that the alcohol is flat calories and nothing else, no nutritional value. So you should try to restrict yourself, either abstain from alcohol consumption or restrict your intake. How you're going to achieve it? Now, I'll be sharing with you the amount of different types of alcohol, popular alcoholic drinks, which what kind of an amount you can take. Have no more than 1 glass of alcohol in a day, which is the wine, and prefer red wine over the white wine, because red wine has got something called resveratrol, which is a very powerful antioxidant, which can help you protect your heart and brain from the atherosclerosis. That is the process of hardening of the blood vessels, which predisposes you to clot formation. Watch your portion sizes. Like a standard sized alcohol drink is 5 ounce glass of wine and 12 ounce beer, or 1.5 ounce of 45 ml of hard liquor, which is the whiskey, vodka, or this and that. The next point is that you should get yourself screened and get treated for atrial fibrillation. Now, what is atrial fibrillation? It is the irregular heartbeat that causes the clots form in the heart, and those clots can then travel to the brain, producing a stroke. So atrial fibrillation carries almost a 5-fold risk of stroke and should be taken very, very seriously. According to Dr. Rost of Harvard Medical School, it is one big factor which you should control if you want to safeguard yourself from stroke. Your goal should be that if you have atrial fibrillation, get it treated and get it screened from time to time, and take the medication. The medication is actually a clot buster medication, a blood thinning medication, which is taken every day without a break, according to your how much thin the blood has become, according to the dosage which has been prescribed to you. Now, how to achieve it? If you have some symptoms such as a pounding heart, or a heart palpitation, or shortness of breath, then see your doctor. He can screen you for atrial fibrillation by doing an ECG, and ECG can tell us, and certain other investigations like echocardiography can be done, which is a simple ultrasound which is done for a heart of the heart to see. And then a simple medication is started like warfarin, which you should be on for all your life, depending upon how thin we need to keep your blood, at what level we should thin your blood to. So your doctor can guide you the best regarding this. And in the next point, I would like to discuss that if you have diabetes, then you should try your best to control your diabetes. Get yourself treated for diabetes. Don't deny the treatment. Don't deny that you don't need the treatment, because having high blood sugar level damages your blood vessels over time, making clots more likely to form inside them. And it makes the high blood sugar levels make your blood vessels sticky from inside, so that your blood cells can stick together and form the clots, which may then travel to the blood vessels in the brain. So try to take your blood sugar seriously, your diabetes seriously, and treat your blood sugar if you are recommended for if you're recommended a treatment. Or you can get in touch with us. We try and do a lot of lifestyle modification plans for diabetes controlled. I am a certified diabetes educator, a national diabetes educator program certificate holder of diabetes education. Same with my wife, who's a dietitian and a diabetes educator. So we can use diet, exercise, and medicines, a combination or the perfect blend of these three to keep your blood sugar levels within the recommended range. And the next point, and last but not the least, my dear friends, is quit smoking. As uh, I have already spoken about it as an independent risk factor for high blood pressure, but smoking accelerates the clot formation process in a couple of different ways. It thickens your blood vessels, it thickens your blood, it increases the amount of plaque buildup in your arteries. Along with a healthy diet and regular exercise, smoking, cessation is one of the most powerful lifestyle changes that will help you reduce your risk of stroke. And if you're smoking, then you should try your best. We have seen many people failing after cessation of smoking. They quit smoking and they get onto it again. That is not a problem, but keep trying, and one day you will always be successful in quitting smoking, because when you are able to quit once, then you are able to find out the benefits, the better oxygen supply to your brain cells, the better activity level. After some days, you start feeling the difference, the positive difference which the smoking cessation has brought in you. So ask your doctor for advice. There are certain counseling techniques which people are advised with to quit smoking, to quit tobacco. And nicotine pills are some other options, and there are nicotine patches, there is counseling, there are medicines. All sorts of things can be done if you really are serious about quitting smoking. So don't give up, try hard, and you'll be able to achieve it. So that's all, my dear friends, in this video. And I request you to please hit the bell icon on the screen, on the side of the screen, so that whenever we have a new video coming up, you should be the first one to get notified. Please subscribe to our channel, that is Live Life More, which may help you add years to your life and add life to your years. In the upcoming videos, we'll be talking about one very good concept called FAST, which is how to recognize and what action needs to be taken in a stroke. If you are able to recognize the stroke, and you will be able to go to a proper facility to take care of your stroke well in time, so that you don't lose those precious months or years of your life in the bed, limping, and you're not able to lose your life to a catastrophic massive stroke. So my dear friends, this is your friend in health, Dr. Sandeep Jassal, signing off for the moment. Until we meet again, stay blessed, stay informed, and live life more.
अपनी जिंदगी में जोड़िए कई वर्ष, और जिंदगी जोड़िए उन कई वर्षों में. Live life more, live your life more.